Getting the diagnosis right is vital, of course, but it's important for the type or types of seizure to be identified accurately too.
One of the most important things for ensuring that somebody has the appropriate treatment for their epilepsy is to know the sort of epilepsy that they have and the type of seizures they have. It's absolutely vitally important to get an eyewitness account. Most people who've had a seizure wouldn't be able to give you any real concrete information about what they experienced. Perhaps at the beginning of it they may have done if they had a warning, and certainly they could tell you how they felt afterwards, but the actual eyewitness account of the seizure is absolutely imperative.
All over your brain. It's not starting in one place, it's just kicking off everywhere.
It's very important to identify a seizure type that someone's experiencing, because there are different categories of epilepsy and the drugs may or may not be effective for the particular type of epilepsy. So if you have an epilepsy that happens all over the surface of the brain at once, then you have a primary generalised epilepsy. If you have an epilepsy where the seizure starts in part of the brain, then you have a focal epilepsy. Some of the drugs will be more effective for a focal epilepsy than they will for a primary generalised. And in some cases, some of the drugs for a focal epilepsy would aggravate a primary generalised epilepsy. So it is a really important thing to make that differentiation.
I think the thing with medication is that they can't just say this is the medication for you. The doctors, it's an experiment that they have to go through to find what medication actually suits you. So it took a while for us to discover not just the medication that suited, but the dosage that suited. And this possibly took about a year before we could work out that the anticonvulsant medication was working for me.
A lot of people feel that their healthcare professional is trialling drugs for them and they don't really know what's going to be effective for them. The reason for that is, although we'll know broadly what drugs will work for what type of epilepsy and what type of seizures, it's virtually impossible to predict what an individual person's reaction to a particular drug will be.